Hey everyone, Dr. Sinicropi here to talk to you about what is the number one question that random people ask me when I'm walking around in the halls. The number one question, hey doc, my back or my neck really hurt, or I've got this pain down my leg or my arm. It's the number one question from random people, some of which I know, some I've literally never met before. And so what are the 5 things that I tell them may happen as far as how they can treat their pain? Number 1, physical therapy. Now, almost every patient that I see, we end up sending to physical therapy, both for strengthening and to improve their pain if they are mobile enough to do the exercises and activities. But physical therapy is an absolute go-to. Number 2, chiropractic care. Now, somehow, people believe that chiropractic care is controversial, and many of my spine surgeon colleagues do not recommend chiropractic care in many circumstances. I've been using excellent chiropractors here in Minnesota for the last 19 years, and I have to say that these guys have done an amazing job in improving patients' lives through chiropractic modalities and other modalities that they offer in their clinic. My only ask is if the patients are not doing well, or if they're seen to have very serious pathology, they absolutely need to be referred to a spine surgeon for an evaluation so that they are not put in any jeopardy. And I can tell you, the men and women that I work with are amazing at referring people back or just referring people if the condition warrants. Number 3, and one of my favorites, and you guys know this, class 4 laser therapy. Unbelievable results, both in the literature and in my experience now, having referred out so many people for class 4 laser therapy. It's non-invasive. The results can be very, very rapid. And many of the patients I see back have tremendous results from laser therapy. Laser therapy is also an excellent adjunct therapy to physical therapy and chiropractic care because they're able to do more with their clients and patients when they've had their pain reduced by class 4 laser therapy. Number 4, now when things are more severe, or if you have severe sciatic or radiculopathy, we often will use injection treatments. The most common is the epidural steroid injection, which gets placed next to a nerve, which is like giving an aspirin to the nerve, which reduces inflammation around the nerve. This can be highly effective for nerve pain. We can also do injections around the joints and the ligaments and the soft tissues that can all be helpful. There are other invasive interventional procedures, non-surgical, but some invasive, that can be extremely helpful in patients' pain. And last, but certainly not least, is surgical intervention. We try to do minimally invasive or motion preservation on patients that are candidates for this. Unfortunately, some are not candidates and need larger open surgeries, but the results of surgeries for specific conditions can be outstanding and can restore patients' lives. And so this is my elevator speech when people ask me, well, what do I do about this condition when I've never seen their films? I can at least give them a basic outline of our mentality and how we're looking to treat them in the future. I hope this helped. I'm going to make videos on all of these things, going much more into details on all these treatment modalities. Until next time, Dr. Sinicropi out. Make sure you follow me on all my socials, and hopefully you get something out of the information I'm trying to get out there.